This conversation is taking place at Hagley Museum and Library.
We're talking here with Dr. Robert Laskowski, President and CEO of Christiana Care Health Systems. Bob, talk a little bit about your background and what skills are needed to head a major health system.
Well, my background, thanks, John. My background is first and foremost as a physician, and that I think is very important for me personally, and important for me professionally in my role in serving the community as best as I can as president of Christiana Care. I think that it's quite important for a nonprofit health system like Christiana Care to keep focused on the things that matter most, which is taking care of people. We are a large business, quite a large business, actually the largest private employer in the state of Delaware, with roughly 11,000 employees. But what people expect when they're sick is to be cared for as individuals with excellent care, technically excellent, and compassionate care. So my background as a physician reminds me that that's why we do what we do.
A health system's a lot more than just hospitals. Explain just what Christiana Care is and how it operates.
The health system is much more than a hospital. Hospital is just one part of the array of services, one way of organizing services to help people to get better when they're sick and stay healthy when they're well. We at Christiana Care have two hospitals, and we have a large number of physicians, 1,400 physicians, literally thousands of nurses. And these individuals, talented health professionals, among other disciplines as well, are not only in our hospital campuses, but through about 60 sites throughout Delaware, actually throughout a 4-state area. And our Christiana Care home care services are quite literally in people's homes every day, helping them to have the ability to stay there and get better at home, where most of us would prefer to be.
One of the things that you hear fairly regularly is the skyrocketing cost of healthcare. Yeah. Why is this happening, and what do we have to do to contain those costs without losing the quality of care?
Well, the costs are going up, and there are many easy to see. All one has to do is go on the internet and look at Google and Medicare costs. You'll get a graph which is scary, and it's quite possible to our society is rapidly growing the costs of health care in ways which I don't think are sustainable or good for us, either inside the industry or certainly as a community. There are many reasons for this. Health technology is one of those. The high cost of producing healthcare professionals, the specialization that comes with care, and our own desires as people to have things that we think will help us. Some of them are quite expensive. At Christiana Care, the cost of care is a major concern for us. In fact, very explicitly we talk about it, and we talk about it actually all the time. And if you looked over the last 2 years, we've actually reduced the cost of care, a measure we call the adjusted discharge. It combines inpatient and outpatient care, and that number went down over the last 2 years, and it needs to continue to go down. To do it, we need an engaged fellow citizens in the community, and we all need to look at very carefully at what the services we demand, and we want, and that we in the healthcare world provide to make sure that they're valuable for us. And by value, I mean making a difference in our lives, not simply something that could make a difference.
Thank you, Doctor.
Thank you.
Stay connected at Content Delaware.